Okay, so Janice will give you the thumbs up here in a second. Okay, Dr. Sanchez, you're good to go.
Oh, good. Sorry. Hi, everyone. Welcome. I'm Dr. Javier Sanchez. I'm a family practice physician with Kaiser Permanente, past president of the San Bernardino County Medical Society, and a founding member of our Inland Empire Climate Health Action Coalition, a coalition made up of the San Bernardino County Medical Society, Riverside County Medical Society, and the Inland Empire public health departments, both from San Bernardino County and Riverside County. Again, thank you very much for joining us again. This is our 5th webinar in a series of 6. Today, we're incredibly happy to have 2 extraordinary physicians that are working on climate change here at the here in California and in the nation. And a lot has happened in the last 3 months. And every day I wake up and see new changes that are happening at the federal level. And I'm really excited to have these individuals here. So far we have learned about what the science of climate change. We have learned how to communicate about climate change. We have learned about the economic impact of climate change. And then we heard from our local public health folks here in San Bernardino County and Riverside County. And today we're very lucky to have these 2 extraordinary individuals. So for that, I'm going to pass it on to our CEO, Allison Elsner, to introduce them, and let's get started with our webinar.
All right. Thank you so much, Dr. Sanchez. Hi, everyone. Thank you all very much for joining us today for our 5th session, as Dr. Sanchez mentioned. And before we get started, we do want to remind everyone we have a fantastic 1st annual Climate Convergence Conference coming up in person on Friday, May 30th, and that will take place at IEHP. It's free to attend. We are looking to have folks have exhibit vendor tables there. So if you're interested in that, please let us know. We'll put our contact information in the chat, but the conference is free to attend and we have some wonderful speakers. So we'll get you more information on that. For now, though, we are so honored to have 2 very, very strong and prominent leaders in the climate movement with us today. And I'm going to go ahead and introduce both of them to you right now. Lisa Patel, MD, is the Executive Director of the Medical Society Consortium on Climate and Health and Clinical Associate Professor of Pediatrics at Stanford School of Medicine. She is also a member of the Executive Committee for the American Academy of Pediatrics Council on Environmental Health and Climate Change. Dr. Patel received her BS in biology from Stanford University, her master's in environmental sciences from the Yale School of Environment, her medical degree from the Johns Hopkins School of Medicine, and she completed her training in pediatrics at UCSF. She's a former presidential management fellow for the Environmental Protection Agency. So thank you, Dr. Patel. And then I'm also going to go ahead and introduce Ashley McClure, MD, who trained in internal medicine at the University of Washington in Seattle, Washington, her hometown. She has been practicing outpatient primary care in Oakland, California since 2016. The climate crisis became personal for her in 2018 after becoming a new mother with a baby at home with weeks of smoke from the Paradise Fire that November. Since then, she's been working to bring the power of her own and all health professionals' trusted voices into climate advocacy at the policy level in the interest of catalyzing a rapid transition to clean, renewable energy in the interest of protecting all of our loved ones and for health and equity for all. Dr. McClure has been an alternate delegate for both the AMA, the American Medical Association, and the CMA, the California Medical Association. She co-founded and co-directs the California nonprofit Climate Health Now that organizes the health community around advocacy for equitable climate solutions. And she's the state clinician for the climate group, Medical Society Consortium on Climate and Health. She was a Climate Health Organizing Fellow through the Cambridge Health Alliance in 2020, and she always welcomes you to reach out. So we'll put Dr. McClure's, Dr. Patel's contact information in the chat as well. doctors, welcome to both of you. And I think Dr. Patel, you're going to start first.
Thank you.
So, oh, sorry, Ashley, you can start us off since you wanted to walk us through an exercise.
Sure. So we're really excited to be here. It's an honor. I've gotten to do some really exciting work with Dr. Sanchez in the CMA arena. So thank you for having us. I wanted to just frame kind of the outline for our hour together that Dr. Patel is going to start by talking about some of the data about how the changes in climate are already affecting health in California in particular, related to heat and drought, exposure to wildfire smoke. And then my favorite thing to talk about is what to do about it. So we're going to finish with two really clear, really important ways to collaborate if you want to channel your concern and your resource, as a health professional into working with colleagues to make a difference. So that's what we'll do with the hour. And we wanted to just start by sharing. So if everybody would be willing to actually put in the chat, and then we'll speak to a couple of them, but could you put in the chat a way or maybe a couple of ways that the changes we've had in the climate, particularly in Southern California, how has this already affected you personally? We would love if people could contribute some. Or does anybody just want to speak out some ways that you've already been affected personally? Yeah, fires kind of unparalleled impact this fall in LA. Breathing problems related to the fires, air quality. Yep, exactly. So there's nothing, theoretical or objective about this. This is something that really affects us in personal ways in California, and we just want to honor that, and we'll honor that by showing ways to get involved in addressing it towards the end. So thank you for contributing. To Lisa.
Okay, great. Ashley, are you driving? Who's driving the slides? Oh,
I am.
Okay, great. So thank you so much for having us. And I'm both a pediatrician and I also lead a large organization called the Medical Society Consortium on Climate and Health. And we bring together over 55 major medical societies, including the AMA, AAFP, ACEP, and others, to make climate change about health. I hope I don't need to convince anybody on this call. It sounds like you've had a lot of education before this, that climate change is a here, now, and us problem. I've been studying climate change since I was in college. So a quarter of a century ago, the way it was presented to me was a distant problem in a distant time and place for a distant species. But we understand that the effects of climate change we're experiencing right now, it's happening in places all around the world. And yes, it is a problem for other species, but it is profoundly an issue of us and our health. And so I like this quote from the Lancet Countdown: every child born today will be affected by climate change. How we respond will determine the world we live in tomorrow and will shape the health of children across the globe at every stage of their lives. So the question we should be asking ourselves is, are we creating a world where children can merely survive, or a world where children can thrive? Next slide, please. Click back once. So the work of the consortium, as I mentioned, when you say the words climate change, most Americans will think of this picture. They'll think of the polar bears on an iceberg with a baby cub. And absolutely, the polar bears are being affected by climate change. But the work that we do at the consortium is to switch the frame. So if you can click forward. So that when you think about climate change, this is what you're thinking about. You're thinking about, and I think this was mentioned in the chat, right? We're thinking about breathing problems. As a pediatrician, I'm always thinking about making sure that every child has the opportunity to start with a good beginning. And fossil fuel pollution results in two types of pollution. One is the carbon pollution that's driving the climate crisis. The second is particulate matter pollution. And we know that that pollution crosses the placenta, enters a developing fetus. And so many children in this country are born pre-polluted, places them at higher risks for problem like asthma and tons of other problems down the road. So this is what we do at the consortium, is really to, when people are hearing the words climate change, they're thinking about people and our health and our well-being. Next slide, please. Ashley and I are not the only ones who are saying this. We are joined by our estimable colleagues at places like the New England Journal of Medicine, BMJ, and The Lancet, which a few years ago now published the same editorial on the same day, and this had never been done by medical journals before, calling climate change the greatest threat to public health in the 21st century and imploring our leaders to act to keep us below 1.5 degrees of warming. Now, 1.5 degrees of warming, and y'all might have seen the news, we think we've exceeded that threshold. This was really more of a politically decided number of what we thought we could achieve, and we've blown past that. And if you look at the Intergovernmental Panel on Climate Change, the concern is that we could probably reasonably adapt to 1.5 degrees. There are harms that we will need to adapt to, but we can adapt. We worry that past 2 degrees, it will be very difficult, if not impossible, to adapt, and past 3 degrees, the structures of human civilization as we know it are unlikely to be able to continue for a lot of reasons, whether it's migration or our food supplies or the constant disruptions that we can expect from climate disasters. So we are on a concerning trajectory, especially given the actions of the current administration on a federal level. Next slide, please. I'm going to focus specifically on what I think are threats in the Inland Empire, but I did just want to raise a few other issues in other parts of the world. You know, my family is from India, and so certainly we are seeing parts of the South Asian continent that are exceeding what we call the survivability threshold, and I'll talk more about what that means. We can expect many island nations to disappear, if not in my lifetime, then the lifetime of my young children. A few years ago, 8 million, a third of the country of Pakistan was underwater from historic monsoon seasons, and a third of the population, 8 million people there, still remain displaced. And then we in California are unfortunately quite used to wildfires and wildfire smoke. But last summer, or I guess 2 summers ago now, there were huge wildfire plumes of smoke that entered the East Coast. And so what we're seeing, I like this term for Dr. Catherine Hayhoe, she calls it global weirding. It's that we're seeing these new phenomenon in new places where people weren't expecting them, and they're not adapted or equipped or ready to deal with these new threats from the way we've severely and rapidly changed our atmosphere. Next slide, please. As I said, it can be like a months-long lecture to talk about all the various ways that climate change is affecting our health. I work with doctors from head to toe, so from the ophthalmologist down to the podiatrists, and all of them will tell you the various ways that climate change is affecting the different organ systems in the body and affecting also every single life stage. As I mentioned, that pollution crosses the placenta, and so from the time a fetus is in utero to the time where they take first breath, through their childhood and into adulthood, climate change is affecting every life stage and every organ system in our body. Next slide, please. I just want to do a little grounding in terms of the data for the Inland Empire, and then I'm going to go specifically into 2 issues just to really connect it in terms of the impacts of things like heat and wildfire on health. So climate change will reshape the Inland Empire in terms of days of extreme heat. And so we expect that by around 2050, that there will be a similar number of hot days as what is in Phoenix currently. So I think that the projections I saw was somewhere between 25 to 30 days where you're exceeding 102 degrees. And right, these are areas that are not adapted for that level of extreme heat, whether we're talking about the infrastructure that's there or even the natural ecosystems that are there as well. There's concern that places like Joshua Tree, that much of the vegetation there wouldn't be able to survive temperatures that extreme for that period of time. You can see that drought conditions. So what we're seeing in California is really whiplash. We'll have these years of terrible drought, then followed by years of tons of rain. But you can see in the signal that we're seeing these times of greater, deeper colors of that, the magenta and the orange, indicating greater levels of drought as we carry forward and the earth gets warmer and warmer. And then I think a couple of people mentioned the threat of wildfires, where it's really hard to model what will happen with wildfires because there are so many various things that go into those projections. But roughly, we expect about a 50% increase in the amount of in the number of wildfires by 2050 as well. And what that will mean in terms of both the health risks in terms of people breathing in that smoke, but also the displacement that will happen as a result of it. We're already seeing in California that home insurance companies are withdrawing from places that they consider to be higher risk because they don't want to insure places that they know they're going to essentially lose money on. Next slide, please. So first I want to talk a little bit about heat and what it means in terms of health and inequity. This picture up here on the top left, just speaking of Phoenix, this is a man who stepped outside his door. Phoenix, if you aren't aware, had greater than 30 days of temperatures topping 100 degrees for the last couple of years. And Phoenix is no stranger to extreme heat. But what I think is new is the severity, the duration, and the fact that it's not really cooling off at night anymore either. And when it's that hot outside for that many days, the pavement really holds on to that heat as well. And so he stepped outside, he got dizzy from the heat, he fell on the pavement and sustained a 2nd to 3rd degree burn just from falling on that pavement. And I actually met somebody from Phoenix yesterday at a meeting I was with, and she was saying that they're seeing lots of kids that are coming into the emergency room with thermal burns when they fall on the pavement or when they're playing on the playground. I practice as a pediatric hospitalist. And so this is some data from, I work 24-hour shifts and have the benefits of when it's a holiday weekend, we get to work the full holiday weekend. So I was there for 2 24-hour shifts for Labor Day when we had this heat dome event, and it was 116 degrees in Livermore. And those 2 shifts rivaled some of the busy shifts we had during the pandemic, from the number of deliveries I was being called to because there was concern for things like meconium, where they were calling maternal temperatures. Later, we realized that the rooms that were south facing had literally heated up so much that the mothers themselves probably warmed up from that because our air conditioning couldn't keep those rooms cool enough. And then the number of children that were coming in with respiratory issues or dehydration as well. And then that picture on the bottom right is just a heat map of what the United States looked like 2 summers ago. Last year was the hottest year on record. The year before that was the hottest year on record. We expect this year to break last year's record. So you can see which way this trajectory is going. Next slide, please. This was some reporting that came out of Oregon when they had a heat dome settle there a few years ago now. It said physicians raced to provide fluids to patients who arrived breathless, dizzy, and drenched in sweat. Others were brought in on stretchers, their body temperature so high, their central nervous systems had shut down. Those who could still speak spoke of stifling apartments. Do you mind going back? I should have this quote memorized by now, but it might be Ashley's daughter that's helping us with the slide movement. Those who could still speak told of stifling apartments and some that made their skin sizzle. Some had tried to walk to county cooling shelters only to collapse in the blistering heat. So I mentioned the survivability threshold before. We've done physiologic studies on the human body, and the studies show that an otherwise healthy adult at rest, in light clothing, drinking water continuously, can handle 115 degrees with minimal humidity. And we are breaking through those temperatures all over the place. Now you add humidity into the picture and the thresholds for those temperatures drop. And so what this means is that we're starting to see more and more parts of the world where we're exceeding what those survivability thresholds are. And so these are not places where we can expect people to continue living in the long term. Next slide, please. When our bodies experience extreme heat, 2 things happen. So the primary way we have within our bodies to cool down is sweating. It's like a sprinkler system. So our blood heats up inside our body. We notice that our blood is hotter than it should be. We start pumping the blood out to the periphery. And basically, if we it's evaporative cooling to cool that blood down by sweating, and then the blood travels back centrally. If our body is still sensing that body is too hot, this is really the only mechanism we have. So we keep pumping it out into the periphery, and then we stop pumping blood to our vital organs in the process. So as this happens, your heart starts beating faster. You can expect that your patients that are elderly can't tolerate that for a long period of time. We often see a lot of deaths at nighttime when the elderly don't get a chance for their hearts to be able to get a break from how hard they were working during the day. Your blood volume drops as you lose volume from sweating. And then if this goes on, it can result in end organ damage and then ultimately in heat stroke and death. Next slide, please. The distribution of heat is not equal. And so what we often see in urban landscapes, for example, is that places that have been traditionally redlined tend to have both less amenities, whether we're talking about access to air conditioning, but also less amenities in terms of access to green spaces that physically cool places down. And so we place people at greater vulnerability, both by our lack of investment to ensure that there are places of cooling and by lack of access to the resources that can help them stay cool, whether these are public places of cooling or them having individual access to air conditioning. That difference in temperature can be up to 7 degrees between a place that was not redlined versus a place that was historically redlined. The way these patterns play out is really different from place to place. I'm providing the example of what I know really well because I live in San Francisco, but these structures are recreated all over the country in different ways. Next slide, please. As we think about our patient populations and who are the most vulnerable, pregnant individuals are at higher risk for adverse birth outcomes. I'll talk about that more in the next slide I'll show. Households living in poverty may not be able to afford energy bills. We see this time and time again, especially in this situation where we're seeing more families with food insecurity, housing insecurity, not being able to pay their basic bills. The energy bill is probably the last thing on their minds because of everything else that they need to pay. Infants in particular can't effectively thermoregulate, especially in the first week of life. I've cared for a number of infants now. Either they were in an apartment that didn't have air conditioning, and so they came in severely dehydrated from that, or it was that the parents thought that, oh, it's really hot outside, they must need water, and so they were giving water to an infant less than 4 months of age. That can be dangerous. I've also cared for a number of outdoor workers and athletes who have come in during periods of extreme heat. What is especially dangerous is these times when, and usually this happens around the springtime, when the temperature swings really quickly. Our bodies can actually adapt if they have some time and they're stepping up to doing more work in the heat. But if it's, one day it's 60, your body's adapted to 60 degrees and suddenly you're up to 80 or 90 degrees, and then you're putting somebody who isn't conditioned for those temperatures to deal with it, the body has a hard time, particularly the older they get. And so making sure, I work with pediatric patients, but for those with chronic medical conditions or the elderly, just making sure that they're aware that those swings in temperature can be really dangerous. Next slide, please. As I mentioned, I think this is a population that most people don't really know what the data is on, and I think our counseling needs to catch up to it because pregnant individuals are at high risk for adverse birth outcomes, both from air pollution and from heat. And this has been a really impactful paper from JAMA that came out a few years ago. So heat and air pollution are associated with preterm birth and low birth weight infants with marked racial disparities, especially amongst Black and Hispanic women. Now, the reasons for that are multifactorial and include higher exposure to air pollution from redlining, poor access to prenatal care, and the toxic effects of racism on a mother's health. Next slide, please. Any questions about heat before I move on to wildfires and air pollution? All right, these are, again, I like to provide pictures of what I know best, and much like Ashley, 2018 was a year of awakening for me. And so I keep these pictures from the Paradise wildfire because one of the things that worries me is that we will start to accept this as our new normal, and nothing about this is normal. It's not normal to keep our children or our babies inside for weeks at a time because it's too toxic to be outside. We've unfortunately seen so many pictures now of just terrible destruction. This was paradise, but we've seen it. We saw it in LA, we've seen it in Lahaina. This picture in the middle is the San Francisco skyline on a clear, beautiful day, and below it is the same skyline during the Paradise wildfires where you can't even make it out. Our air pollution on those days and weeks rival places like New Delhi that don't have the same protections in place for clean air. And then you could see the plumes of smoke from the sky. The fires were so overwhelming. Again, this felt remarkable in 2018, is feeling less remarkable now because we're seeing it over and over again. Next slide, please. All pollution is bad for us. I can't believe I have to say that, but it bears repeating, especially if you paid attention to Lee Zeldin, who's a new administrator for the EPA, has declared that they will be rolling back 31 rules that hundreds of thousands of Americans provided public comment in support of to have clean air and clean water. And not only does it have the vast support of Americans, it also has great support in the science. So we know that when you burn anything, whether you're burning coal or oil or gas, or whether an entire house or car goes up in flames, it produces these tiny particles. It's called particulate matter pollution. And the smaller the pollution, the worse the effects on health. The best data we have, now they're ultrafine particles. Those are very hard to study. So the best data we have is on PM 2.5. These are particles that are basically the fraction of a width of a human hair, so small that we can breathe it in, it can enter our lungs, our vasculature, it crosses the placenta, as I mentioned, and essentially sets off inflammation. This graphic here of the red and green outcomes, it's a bit old, I would say, but the ones that are the best established in the literature is that chronic exposure to particulate matter pollution results in premature death, stroke, heart disease, asthma, lung cancer, reduced blood function, and low birth weight. Alzheimer's was in green when this graphic was created. We have very good evidence now for the links between chronic exposure to air pollution and the links to Alzheimer's disease. The concern with wildfire smoke is that we estimate it to be 10 times as toxic as the regular air pollution we are breathing by burning coal, oil, and gas. And that shouldn't surprise us, especially these wildfires that are happening in urban environments where batteries are burning and paint thinners are burning and furniture is burning. We see lots of other toxic chemicals like lead and copper and arsenic and polycyclic aromatic hydrocarbons. All of these chemicals have damaging effects on our body. And people often ask me, well, what's going to be the effect in 10 years? And I say, we're living a natural experiment now. We have data from 1 or 2 years, and it should concern us because we continue to see the health effects a couple of years out, and we'll have better data in 10 years. Next slide, please. The effects of wildfire smoke can be through the life stage. So for pregnant individuals, there's a higher risk of gestational diabetes, hypertension, a higher risk of miscarriage, prenatally, low birth weight infants, preterm labor. One of my colleagues is working on a study looking at data for the risk of stillbirth as well. Early childhood exposure increases your risk for asthma, respiratory disease. We're starting to get better data on things like how it affects immune function. A colleague of mine at UC Davis just did a study on how wildfire smoke exposure actually interfered with the efficacy of the COVID vaccine to show how it's interfering with our immune response. And then the effects go into elderly exposure as well with cardiovascular, respiratory disease, and as I mentioned, Alzheimer's disease is a risk as well in dementia. Next slide, please. Who is exposed to air pollution is also not accidental. I mean, I call myself an unfortunate expert in wildfire smoke. It's not I grew up as a little girl dreaming that someday I would carry an expertise on this topic. It is just something that has happened by necessity. And so during the Los Angeles wildfires, I was doing a lot of press and media and had actually a number of individuals of extraordinary wealth reach out to me for advice on what they could do to keep themselves safe. And I've seen this play out over and over again, where those of us with means, right, we'll be able to create a well-sealed home, invest in the air purifiers, keep ourselves safe. Who is going to be left vulnerable are individuals who are experiencing housing insecurity. They can't pay for those types of amenities to keep themselves safe within their home. On top of that, they're living in neighborhoods where they are exposed to more pollution because of the policy failures of our society. And so these are pictures in California, right? The fact that there's a freeway right next to where kids are playing soccer. There's an oil drill right next to this in this community, within this community where people are living. And we know that these industries and being close to proximity to roadways that large expose children to this very toxic pollution. As a result of these decisions, a Black person is 4 times as likely to die of fossil fuel exposure compared to white people, and 75% more likely to live in communities that border a plant or factory. Next slide, please. The final thing I wanted to mention, and then I'm done depressing you, and then Ashley's going to lift you all up, is mental health. We can't talk about anyone's health without mentioning mental health in this day and age. And again, I'm going to bring my frame to it as a pediatrician. We understand what the effects of toxic stress are on the health of our patients, and that for each adverse childhood event or toxic stressor that we rack up, and these are things like food insecurity, housing insecurity, a caregiver themselves that has a mental illness, every one of those we rack up, you have a higher risk for chronic conditions down the road. And what I worry about as a pediatrician is that climate change takes each of these adverse childhood effects and increases both the likelihood and the severity of it. So we are in essence setting up an environment for our children where they cannot thrive because we're not creating the right conditions for it. Added into this, we do have a mental health emergency in our children and our adolescents. And we know that climate change is making that worse. And so there was a study of 10,000 youth by Hickam et al. That found that 75% of young people felt that the future is frightening, and rightfully so, especially as we see these crises get worse. But there is hope. And here comes Dr. McClure to bring us that hope and bring us the solutions to the litany of problems that I have just raised.
No small task. Thank you, Dr. Patel, for laying it out. And I think it's so important for people in health, nurses, doctors, to feel really confident that the evidence base is unequivocal, that climate change is a health crisis. Because it can feel like it's not in our lane, like so many, public health issues, but it is, and the evidence is on our side, is clear, and gives us an opportunity and a responsibility to get involved. So essential foundation and confidence to give us. And I'm going to just start with why I got involved and why I decided that I had to get involved. So it involved my first daughter. You might see my second one today because the babysitter's late. But my first daughter was born in 2018, and on leave, I accidentally kind of just fell upon watching the Inconvenient Truth sequel on my phone while she was asleep. And I had, I was on maternity leave for the first time after 12 or so years of just working really hard and all the training that we go through and being a primary care doctor. And I had this wake up, like, wow, the experts, they're really clear what's wrong, but they don't have the power to change what's necessary to avert the way we're, the direction we're headed. So this was simmering. This is summer. I'm a new mom. Your heart like breaks open. Her future all of a sudden made 2030, 2050, not just numbers, but like her college graduation, her, different times in her life. And then when my first daughter was 6 months old, the Paradise Fire that Lisa just mentioned happened. And for 2 weeks, I live in a 100-year-old house. For 2 weeks, the air quality, that's when I learned about AQIs and what they meant and how, if it's over 200, that's toxic for babies, and drafty old house, trying to do what I could, staying inside, going a little bit insane. And I just had this kind of reckoning, really, that this is where we're headed. Like Lisa just said, we're causing more fires by burning fossil fuels. This is, clearly physics is doing this based on greenhouse gases and global warming. So learn about AQIs, learn about how bad they are, not just temporarily in the Bay Area or in the West from fires, but how they always are in India because of fossil fuels. So I used to think being a doctor was sufficient, but then because I became a mom, it became very clear that I was totally inadequate for this moment in history. This is my picture of a reckoning, my reckoning. So then I started talking to people. I was like, what do you know about climate change? What are we gonna do? I got back to leave on December 3rd and I gave my first talk. I didn't know really what I was talking about, but I knew there was a problem. We should talk about this on December 4th. And I haven't stopped talking. And I started doing work, just generally with like groups like the Citizens Climate Lobby. But the reason I'm talking to you and the reason I work really closely with Lisa and others in health is because we have a unique resource to bring to this problem, and that is our voices as nurses and doctors and health professionals. There's a real challenge with, trust in our society in general, but still, nurses are always the most trusted profession, and doctors are usually second, and then pharmacists. And I think that's what I'm really excited about helping you to use for the greatest good in solving this problem. So this was the beginning. This was September of 2019. We literally went to, at the time, Senator Harris and the late Senator Feinstein's office, and we were talking about how we can take care of people clinically, but if you all don't change policies upstream to transition away from dirty energy, like what we do in the clinics, it's not enough, So we've been doing that ever since and really helping colleagues to see how to get involved as health advocates in the climate movement and have fun doing so. We really believe that's important and possible. So this is a picture of Lisa in front of the US Capitol at one of the consortium's meetings, which I couldn't recommend more. Just got back from that myself from DC. This is a group of us advocating last summer for a package of policies related to cleaning up dirty energy, dirty leaky oil wells in Sacramento. And this is just kind of a taste of what we do through the nonprofit called Climate Health Now, which I didn't set out to co-found, but I did with my partner, Amanda Milstein. So you are all really, really warmly welcome to join Climate Health Now, which is a community organizing nonprofit up and down California that is working to bring people in health into climate advocacy in a meaningful way. So I'm going to put our website in the chat, and then also I'll mention this, but we have, so Lisa shared the problem. I think you already know that in your soul. We all know how bad the problem is. So my favorite part is just talking about, we know the problem. We know we have something to bring. We know we have a unique resource to bring to bear to solving this problem. So I'm going to discuss two extremely concrete ways to channel any ounce of interest that you have in helping to solve the problem. So the first one is for you to join Climate Health Now. And what that means is going to our website and just saying, I want to join as a member. So the first opportunity is just to join, and that will, you'll start to get our communications, which talks about the different opportunities for work we have. We do some amount of work in just healthcare sustainability itself, which is important. We have to get our own house in order because does anybody know what % of US greenhouse gases come from the healthcare sector itself? Any guesses out loud or in the chat? I'm going to wait till somebody guesses. It's okay to be wrong.
20%.
20. Yeah, so that is close. 8 to 10% of US greenhouse gases come from healthcare itself. So there's obviously an intrinsic, thank you, Allison, by the way. There's an intrinsic irony to that, right? We're in the interest of protecting health and we're contributing to the health, harms. indirectly, and it's nobody set out to do this, obviously, but there's work to do is the main point, to decarbonize healthcare itself, to take out all of, all the ways we can to lower our own climate contribution. So Climate Health Now does a good amount of healthcare sustainability itself, because everybody gets up in arms and just feels wrong how wasteful it is. And we see it and it bothers us. So that's a lot of our work. And then a lot of our work is learning how to be an advocate, and that's not that some people kind of feel like medical training is sort of tries to make us apolitical, but health is political. And we approach this from a totally nonpartisan way, but in a way that embraces the fact that policies affect health. And so we need to be advocates for health, no matter which, color your party. So the first really concrete thing is I'm inviting you all to our community meeting, which is literally a week from right now. So in 1 week, on March 20th, we will be on Zoom. We'll be talking about how to talk with colleagues, to invite colleagues to join us in work. And that is going to be fun. I will be there, and you are warmly welcome to join. So that's the link to register. Does this sound at all of interest to anybody? Can I see a Zoom hand raise? Sarah, Scott, Sophia, Soteria, anybody? What do you think? I see a couple. That's really great. Arthi, yes, thank you, Arthi, and April. Really excited that this is of interest, and we'd love to have you. So that's one thing, is joining the meeting next Thursday. And then the other really timely, important thing, has anybody heard about this bill that's been introduced in California? It's called the Polluters Pay Climate Superfund. Has anybody heard of that yet? Not yet. Okay, good. So I'm glad we're having this conversation. So Vermont and New York have just passed similar legislation in their state legislatures. And this was just introduced last month in California. And it's a bill that is based upon legislation that was passed around cleaning up Superfunds. But this is a Polluters Pay Climate Superfund Act, introduced by Senator Menjivar and Assemblymember Addis. And the premise of this bill, which is active in the state legislature, the premise is that climate change is costing a lot of money, but nobody needs to be convinced of that. The LA fires, on the order of $250 billion worth of damage just this year, which isn't surprising. But the challenge is who should pay for that. And I think people have alluded in the chat and conversation about how insurance in California for homeowners can be impossible to get or extremely expensive to get. And that's related to these climate events. These are not random events, right? These are exacerbated by global warming. So if you were to ask me, who should pay for all of these climate disasters, I would say, and I hope you would agree, that the mega polluters, Exxon, Chevron, BP, the corporations who have pursued profit on a quarterly basis at the expense of the whole world and are raking in unprecedented profits while the world is suffering from the externalized cost of their model, they should be paying to help clean this up. And that's the premise of this bill that I'm going to invite you and hope that you will be interested in helping us to pass. So I kind of spoke to this already, but the specifics of what this bill will do is, first, it'll start with quantifying the total damages that California has already experienced in terms of fires and heat waves and extreme weather events and air pollution, mortality, morbidity. So quantify all the damages to the state caused by fossil fuel emissions. And Cal EPA will do that. And then there will be a identification of who has contributed. And this is not individual, this is focused on corporations, on mega polluters who have known this for decades and who have, sown doubt and delayed action. So it will identify who has contributed in California over a 34-year period. And then it will collect a fee that will be put into a pot of money that will be used to address the problem. It will be used to reduce emissions, to adapt to the warming that we've already had, that Dr. Patel talked about, and to help our communities to be more resilient for those heat waves, for the air pollution, for the water issues that we're all going to have more and more of. So that's the kind of three pieces of the bill. Does anybody have any clarifying questions that I could do my best to respond to? Just in terms of what it'll do.
Yeah, this is Arthi, and I really apologize. I'm gonna have to catch up with somebody later because as a federal worker, a lot of other things come up this morning that I joined late. But I was wondering, what is the relationship between kind of Cal EPA and national EPA and the impacts that the kind of recent changes or announcements by EPA and what they plan to and to not regulate impact how something like this could be carried out?
That's a great question. I don't know exactly. I think, a lot of advocates are kind of looking to the states to fill in the enormous growing gaps that the federal kind of agencies experiences are having. So I think we have reason to believe that Cal EPA will still be able to move forward on this. There will be probably challenges, but I think this is still an extremely powerful fight to be a part of. And the degree to which the federal EPA, I mean, Lisa, you could probably answer this better than I can, but we still think that Cal EPA can carry this out.
Yeah, it's a really good question. I don't know that's entirely clear because the regional offices are, I believe, in large part funded nationally. And as we know, all of these are facing cuts. At the same time, there are opportunities for us to do things on a state level, and it might be as these cuts come down and they hollow out the regional offices. And folks don't know, they've cut all the environmental justice staffing out of all of the regional offices recently, and I would imagine that there's going to be more hollowing to come. And what they're doing is they figure they can't easily cut back regulations, so they'll just do away with all the staffing so the work can't move forward anyway. So I certainly think it will be an obstacle, but I don't think it's an insurmountable one.
Yeah. Great question though, and Arthi, I hope you will consider reaching out if this is of interest. So like I said, this bill has been introduced. It's actually been introduced both in the Assembly and the State Senate. And so it's going forward through the committees in both of those houses. So the first committees is going through, I'm going to stop. Does this sound of interest to anybody to potentially help to pass, to get involved in advocating for it? Anybody? Uh-oh. I don't know if I should keep going.
Yes, Michael.
What's that?
Yes, I'm interested in helping.
You're interested. Thank you, Michael. Woohoo! I like your hat, by the way. So these are the state senators and state assembly members that are on the committees where the bill is headed. So Dr. Sanchez is in Senator Gomez-Reyes's district, and we actually have a meeting on Monday to talk with Senator Gomez-Reyes's chief of staff about the bill. So one question is anybody else in Senator Gomez-Reyes's district? She's in, San Bernardino County. I think it's all within San Bernardino County. Is anybody else in that district? Maybe not. Michael, where do you live? Do any of these electeds yours?
I'm I'm doing two things at once. So I'm in Senator Reyes' district.
Oh,
Let's see. I can imagine that Durazo is going to be 100% on board. And of course, I can't speak for them. But
yeah. Well, so we're meeting on Monday. So if you wouldn't mind putting your email in the chat or taking
Right.
mine out of it, to join us. So it's Monday at 1. We have a 30-minute Zoom call, and we would love you to join. And even if you work near her district, I think that still carries a lot of weight. And Dr. Sanchez, it'll be there along with a couple of other people from Climate Health Now. So, but this is a big deal, this bill, and there's a huge coalition that's coming around it to help, move this forward. And I think it would be a really exciting way to get involved. So welcome, Michael. Love to have you. Oh, send.gov. I'm noticing that. Okay. So we can be in touch. And if anybody else wants to get involved, you're welcome to reach out, because I can say the COVID pandemic, being a primary care doc for 13 years, burnout is something that I've dealt with. And I can say that getting involved in, for me, climate advocacy, and whether it's like, gun safety or opioid crisis or any different kind of collective problem, can be really, even though it's more work, it can be very fulfilling and actually help to kind of bring back a lot of the meaning to our work. So I hope some of you will consider, joining Climate Health Now as a member, even joining this meeting on Monday that we're going to have with to discuss the Polluters Pay Climate Superfund. Maybe you'll tell some friends about it, but it's work that's really meaningful, and we hope you'll join. So that's all I wanted to share. And thank you again for having us.
Thank you both for all that information. It's always fantastic to hear from both of you, and seems like every day I learn something new. What's going on? I think all of us are in a position right now with every day waking up and seeing how this new administration is really addressing or not addressing climate change. And I, for one, been very vocal with our local legislators, both at the state and the local and the national level, to really resist a lot of these things that are going on. Some of them are more willing to listen, others may not, but I'll keep doing that. And so we'll keep fighting, all of us together, to make sure that we can have a planet that's livable for not just us, but our kids, our grandchildren, and futures that are going to come forth. So with that said, we want to open it up for questions. We got about 15 minutes for questions. We were hoping there were some questions on the chat. I don't really see any there. Feel free to raise your hand if you have a question or a concern, or a statement that you want to make. I'll keep an eye on that. But as we wait for them, let me ask you both, this is, how do you keep yourself sane with, I know that those of us that have been on this, in this arena, seems like, we're sort of up and down mentally, because, with the previous administration and the IRA that passed that provided significant funding, that was a very joyous occasion for us a couple of years ago. But now we know that that's been defunded, and they're looking at ways to make sure that that doesn't happen. So what do you do to keep yourself sane as we fight this fight on climate?
Lisa, you got to take this first.
Anybody a fan of LeBron James?
Yeah.
Yeah. He has this, he's got this series on the Calm app that I highly recommend. And anytime I feel like I'm losing it, I'll listen to LeBron because he's just so wise. And so back in November, when I knew what was coming, right? We those of us that do this work in service of our patients and communities, I understood what was about to happen and that it was going to be much worse. And so I listened to LeBron and I was like, mind of a champion. And so I started training for my resilience then, because I knew that it's really tough to take care of yourself when you're in the midst of depression and anxiety. And I knew it was just going to get worse and worse. And so starting in November, I started having a practice where I wake up every morning, I do yoga. I build in walks throughout my day. Every afternoon I do a rage activity that's exercise related, rage elliptical, my kids will do rage dancing with me. It's wonderful. And I also have a therapist that I see every week. And I kind of envelop myself in a lot of self-care because I know I need it. This work is really tough. And if I don't have these strategies in place to care for myself, there's no human way that I could carry on doing it. So I knew it was coming. I prepared myself for it, and not to say that I don't still have my bad days, but it helps me move forward. And my kids, I'd say the last thing is my kids. My son is expected to come cuddle with me every morning. And he does so dutifully, and I appreciate him for that.
Yeah, I did not know you were going to loop in LeBron James. That is very interdisciplinary thinking. I would say, there's a lot of people who talk about the antidote to anxiety is action. And I think things are bad. And I think a lot of the strategy of this administration is to overwhelm into kind of paralysis. And I think it's so hard, but staying focused with colleagues on making measurable progress. That's my kind of mantra right now, is to not let that overwhelm happen to the point of stopping our efforts. And then, lots of exercise, meditation, getting plenty of sleep, all those other just kind of putting on your own oxygen mask types of things, spending time with friends, which can be so easy to let go of. So those kind of self-care things, but also being connected with colleagues to stay focused and to keep moving things forward. Because that feels actually like a very important basic thing, especially right now.
Okay, so I also recently I heard some information about the city of Phoenix and how they're working on mitigating the anticipated high temperatures that they're going to have. Are medical societies, whether it's the AMA, the American Academy of Pediatrics and CMA and so on, have they come out with any strong statements regarding what types of mitigating measures we need to take and when it comes to healthcare? Because I haven't seen anything in terms of the measures. I think they may come out with some statements, but not necessarily medical measures that maybe we're doing or we're studying that can help us mitigate these issues that are going to come in the near future.
Yeah, I can talk to, I felt much more hopeful for medical society action before November. We were seeing more and more medical societies doing just really incredible things. I felt like every week, every month, there were societies I wouldn't have even expected where they were creating task force and passing policy statements. I'll say since November, the major medical societies, so AMA, ACP, AAP, ACOG, I don't think it's that they're backing down from the climate work, but I think it's a situation where there are so many assaults coming so fast. I sit in leadership at AAP, and they're very honest with us. They're like, right? So much of what we do in pediatrics, gender affirming care and gun violence and food security and climate change and all these things, and don't even get me started on measles, right? And vaccination. So all of these things are, they told us, so like, it's gonna be coming at us so fast and furious. We're not going to be able to show up for all the things all the time. We have to pick and choose because we don't have the resources, and second, we need to save our ammo. I hate to be military, but like save our ammo. And that's how we've seen it sort of play out, is that I don't think it's that they're not as committed, but I also think that they're being pulled in so many directions by intent, by what the administration is doing. I'm not seeing them show up as much in the climate space.
This is Arthi, and from an infectious disease standpoint, I can say from IDSA, it's same. They've kind of mentioned that obviously there's a lot to advocate for on the infectious disease and HIV front. They've also kind of mentioned that in order to continue to get forums and appointments with Congress, they also have to walk a line that they are still kind of maintaining. So that's another issue that, again, everyone has very different opinions about that. But that's another thing they've mentioned, is that they want to continue to have access to congressional leaders.
Yeah, I just want to piggyback off of what Arthi just said. There was a paper that just came out maybe a month or two ago that was looking at AMA and how they give to folks in Congress who are anti-climate. Here's the issue, to Arthi's point, all of these major medical societies, right? Like the number one issue is physician reimbursement. It's things like Medicare, for example. And so they need to keep the lines open for both members, for both parties. And so they give generously to both sides of the aisle, to Arthi's point, so that they can keep the lines of communication open for when these big pieces of legislation come up. That is really how they drive their membership model. And so, true, the people that the AMA supports, who are anti-climate, they're also anti lots of other things that physicians would find problematic, right? Whether it's gun control or Social Security, lots of other issues get wrapped up in supporting being able to talk to a Republican about certain topics. So it's complicated, I would say.
I think I would also add, I'm a big fan of Bill McKibben, who has a great newsletter. And I think the climate movement, people in the interest of clean energy, the clean energy transition, I think what's incumbent on us now is framing in the way that will win, which is still cost savings. And thankfully, clean energy is cheaper. So we have a capitalist, incentive kind of environment. And thank goodness that there's been enough investment that clean energy, usually we can frame it as a cost savings, and that will win. But I think we have to be smart about how we package things and frame them. And right now we have to change, it's not about the ethics, it's not about the moral, reason, it's about cost savings. And if that's what wins, then we need to do that in the interest of success. So I guess we've got that on our side.
Yeah, to Ashley's point, I was in the forum where we were talking about what's happening in Virginia right now. Virginia is a huge place for AI centers to be setting up shop that we know are very energy intensive. And so Glenn Youngkin, the governor there, is against renewables, bring in the gas plants. But what he's facing is the reality that gas plants take 5 years to build. Whereas utility scale solar, you can do that at a much faster pace. And so this kind of religiosity that is being promoted on the right about how renewables aren't going to be the solution, they're running into some barriers in terms of what's cheaper, what's easier to deploy at scale. And so I hope that the logic and the finances of it really carry the day, because what they're advocating for in the Trump administration makes no sense, not from a financial perspective, not from a science perspective, not from a health perspective.
Good. Anyone else have any other questions? We still have a little bit of time.
This is Arthi again. I want to kind of going from that point, because we've also noticed, again, I work at the VA, and I think initially we were thinking, from a climate and health standpoint, and for many other aspects of the care that we do in public health, that we would be able to make a financial argument. And we have found that those types of arguments do not matter, despite any potential, visible statements to the contrary. And so I do think, though, as Lisa said, to the actual people, and communities, that does matter, and taxpayers, obviously, that matters. And so I do think it's really important that we highlight and kind of vocalize these discrepancies and as much as possible. And I know that, again, I think the leadership of this group and people like Lisa have a lot of visibility and access to press, and again, ability to mobilize communities and citizens to vocalize this as well, because I think a lot of times what is stated as the priorities of the administration are not truly, it's obviously not transparent. It's not truly driven by, financial reasons, despite statements to the contrary. So
Yeah.
just want to point that out, that a lot of times pointing out those discrepancies and kind of what we know to be the priorities of people is really important.
Exactly. Well said.
Well said. And with that, actually, is a perfect opportunity to thank everyone for showing up today and really providing us this excellent opportunity. Our next webinar will talk more about our roles and responsibilities for healthcare and advancing climate change. So that was a perfect segue to introduce our next webinar, which is going to happen on April 23rd. Feel free to register. Feel free to reach out to anybody, any colleagues, whether at work or community members that want to participate in this webinar and in this series that we put together on climate change, because I'm a big proponent that things will change if we act locally. So that's what we need to do. We need to make sure we are educating our neighbors, or educating our friends, educating our family members about the importance of climate change and the impact of it in our health. And if they start to be educated, they're going to start to vote for those individuals that will make a difference and will listen to us. Same time, I want to thank you for coming and invite you to our Inland Empire Climate Conference we're putting together. The webinar series that we put together, we wanted to finish it up with a climate conference here in the Inland Empire. We'll be talking more in detail about what the next steps are, and we'll be talking to our legislators to see what they stand and how they see the future of climate change and how we can move forward. That will take place on Friday, May 30th. You saw there in the chat the flyer. Feel free to register. It's free of charge. But we also want to make sure we invite other folks that may be willing to help with sponsorship and exhibit tables opportunities. Because the more people we have there, the better the event will be for all of us, and the more momentum we can have to continue to move forward with another webinar series next year. So again, thank you for coming. Enjoy the rest of your day. This rainy, looks like more rain is coming here in Southern California. And I want to give a big thanks to Ashley McClure, Dr. McClure, and Dr. Lisa Patel, and our fabulous CEO, Allison Elsner, for really working hard and putting this together, and all of our staff that helps put this together. And thank both the Riverside Medical Society as well as our Inland Empire Healthcare Public Health Departments here in San Bernardino County and Riverside County for coming together and forming this coalition so we can move forward. Have a great day.
Thank
Enjoy the rest of
you.
your day. Hopefully we'll see you next month.
Okay, bye.
Bye-bye.
Thank you so much. That was great. Bye.